You get this term a lot in the news, TMJ. What is TMJ?
Okay. TMJ stands for temporal mandibular joint, or your jaw joint. This is your jaw joint. And TMJ is a host of symptoms that when it describes problems related to the jaw joint. Now, they can be very simple, where it could be like a strain or a stress or bruxing or grinding where the jaw joint hurts for a short period of time, and rest and relaxation, soft diets, bite plates can work. On the other hand, there can be some real problems with your jaw joint. Clearly, you could break your jaw joint in an accident, and that you would need some surgery. You can develop arthritis in the joint. A couple of common arthritic diseases affect the joint more than others, like rheumatoid arthritis can affect the joint. Lyme's disease can affect the joint. And juvenile arthritis, which is arthritis that develops in kids, can affect the joint. And in that situation, you get deterioration of the bone.
Is there anything an oral surgeon can do to help ease a severe case?
Well, oral surgeons can do a few things. The first line of defense, first line of treatment for TMJ problems, generally is general dentists who treat these problems and make splints and can talk to patients and give them some medication. When they need surgery, there's a number of oral surgeons that can do surgery. Most people don't need surgery. And then
there is something they can do?
Yeah, most surgeons, there are three types of TMJ surgery. There's arthroscopic surgery, where you do just similar to what they do with this arthroscope in a knee. They have a very fine arthroscope that you can put in the knee, in the joint, and look around and do some surgery through that. You can make an incision and open the joint, which is very delicate surgery, and try to treat a diseased joint that way. And in very bad cases, where the joints have bad degenerative joint disease, or fractures that didn't heal right, or another problem called ankylosis, where the jaw joint fuses, you can remove all that, and you can put a prosthetic joint in. As a matter of fact, that is one of my major interests, prosthetic joints. I have a patent on a prosthetic joint, and just completing a huge FDA study for a prosthetic joint. There's not too many prosthetic joints that exist for the temporomandibular joint, but that's a very rare finding where people need that kind of surgery, and that's not, but enough people do require it, and that's fairly complex surgery, though.
Pretty rare done, but there is something that can be done in a severe case today.
Yeah. There's, in severe cases you can treat it. As a matter of fact, I was featured on the Discovery Channel about 4 years ago on a program called Super Surgeons. They did a special on a variety of these kind of surgeries, and my show was entitled Unlocking the Jaw, where we followed two kids that I brought here from Dominican Republic, who jaw joint froze as a young child so that their jaw never grew, and they couldn't open it. And those were fairly complex surgeries that I worked with a different kind of team, but that was an interesting period of time to make that show for Discovery Channel.
So there's hope.